In this video, we are going to show you the palpation of PSIS in standing and standing flexion test. Palpation is an art that should be done with a relaxed mind and body. The pressure should not be too hard or firm. Watch the dimples over the skin. This is the place where your PSIS lies. Palpate gently the superior and inferior poles of PSIS. Take inferior poles as the reference for all tests. After you are confident on palpation of PSIS, you can start with the subject standing flexion test, where the examiner's hands are palpating the subject's PSIS and the subject performs flexion of the lumbar spine in a standing position to dynamically palpate the movement of PSIS under examiner's thumbs. Please note under the thumbs, which PSIS moves more cranially or not. The PSIS which moves more cranially is a positive standing flexion test. Also, make a note of the patient's deviation or any coupling movements during this flexion movement. There could be many false positives with this test where ipsilateral QL and contralateral hamstrings tightness can make this test positive. A single positive test is clinically insignificant. So always make sure to do a battery of tests and palpation before you make a clinical diagnosis. For more ISOMT evidence-based manual therapy videos, please watch the next section.